Hey, do you know that prostate cancer is the third most common cancer diagnosed in males in Singapore, and it is on the rise? Hello, my name is Dr. Leow and this is Dr. Ong. Both of us are Singlife LifeSavers and we are here to help you find a better way to manage your health. Dr. Ong, can?
Can.
In each episode, we will answer questions from Singaporeans about health, and today we are talking about prostate cancer.
So the prostate gland is a walnut-sized gland just located below the bladder in front of the rectum. Its job is to produce the seminal fluids that nourishes and transports sperm.
Prostate cancer develops when the cells in the prostate gland grow too rapidly compared to a normal prostate, forming a malignant or cancerous lump. Prostate cancer contributes to 1.3% of total death in Singapore.
We scoured the internet for your questions about prostate cancer, so stay tuned to find out the answers and like and subscribe below for more.
Dr. Ong, how is prostate cancer detected?
So all men aged 50 and above are supposed to have the prostate checked at least every 2 years. However, some men avoid getting checked because the usual way that we check is to put a finger up the rectum to be able to feel the prostate. But there are alternatives, and this includes prostate-specific antigen test, which is a blood test, as well as other modalities including ultrasound as well as MRI that can be used to diagnose and detect prostate cancer.
It is quite scary, you know. I don't have prostate, but I think for the poor man, how do they know they get prostate? What are the things that they need to do?
So unfortunately, prostate cancer in itself at the early phase may not have much symptoms, and hence detection by screening is very important. But on the late stage, there can be other symptoms, and that can include possible blood when urination. There may be pain in the back. Some of them may experience incomplete voiding as well.
But that seems to be quite common in most men, right?
Yeah, that's why it's very important to make sure that you screen once you hit 50 years old. So Dr. Leow, what are the contributory factors to prostate cancer?
Well, like you say, age is a problem. So I suppose aging is one reason that. The other thing is about lifestyle. I think for all the men who are listening to us, please remember, smoking is not only bad for your normal other health like hypertension, but smoking is one of the problems about prostate cancer. The other problem is actually, sad enough, there's certain family history of prevalence, although there's no genetic specific chromosome to detect that. So in conclusion, age 50 years old, do some testing. 2, don't smoke. 3 is if you do have a family history, get it checked early.
Okay, we have a very interesting question from Hardware Zone. Is baldness linked to higher chances of getting prostate cancer?
Wow, okay. No. Baldness has nothing to do with prostate. Baldness, in a way, it is mainly due to a few factors. One, unfortunately, is called like father, like son, right? So if the father has baldness, you will likely know that baldness does follow the family. Now, why is it so? For people who are older, the baldness comes because as you age, the hormone changes. Third thing that could happen is sometimes people get bald because of a skin condition over their scalp. So definitely it is not a sign of prostate at all.
So Dr. Leow, what is the treatment for prostate cancer?
The prostate cancer treatment will very much depend on the diagnosis, right? So the urologists, which are specializing in such treatment, they will have to decide what is your cell type. Whether it's well differentiated, not so differentiated, the treatment will be different. Number 2, it is actually what we call by the Gleason score. The Gleason score is a way whereby they stratify, they tell from the cut of the prostate which area of the prostate are affected. So the Gleason score will determine what treatment they do. The other third point they do is what we call by staging of the cancer. Is the cancer actually only confined to the prostate, which is called the tumor, or the cancer has gone to the lymph node, which is the surrounding area? The other worst case scenario is what we call by distant metastasis. Means that sometimes, like you have said earlier, some of them have backache. When they diagnose that backache, then they found that the primary cell is actually prostate cancer. That is already quite bad. In other words, it is the cell type, the extent of the stages, and then the other one is expectation of the patient. Because it depends on the patient age. Some of them feel that their sexual function, their life is very important, and some of them may even think of possible procreation. So all these things comes into play for the surgeon to decide. Now, as to the type of treatment, after assessing all these other conditions, the treatment can come in 1, surgery. Now you have a robotic prostatectomy. Depends on the size of the thing. They can do a partial one or they can do a total prostatectomy. The second treatment is called the radiation. The radiation of prostate sometimes causes a lot more fibrosis and things like that. Which one is better? It all depends on the assessment. So Dr. Ong, since we are talking about surgery for prostate, right? What are the side effects for prostate surgery?
Okay, so again, it depends on the treatment, but nearly all men do experience some sexual dysfunction after the first few months of prostate cancer treatment. In terms of surgery, there can be multiple complications that can happen, and this usually is quoted by the surgeons. It includes general anesthetic risks, as well as surgical complications, where there can be possible damage to surrounding structures, nerves, and blood vessels. But it's important to note that in Singapore, our treatments are very advanced. Usually the risk is very low.
Looks like the side effects are quite real. So now I have a very interesting question, or you can say awkward question that we received. How soon after the prostate treatment will I be able to have sex, and will I still be able to ejaculate?
Okay, I think it's a very important question, and I think it's probably on the minds of many individuals.
Yep.
So generally about 4 to 6 weeks is typical, but it can take up to a year for a full recovery of the sexual drive and firmness of the erections. However, again, it depends on the treatment that's being done. In the case of a radical prostatectomy, we would have to remove multiple components in the pelvic region, and that includes the prostate gland, as well as the seminal gland that produces the seminal fluid. And in those cases, the ejaculation of semen may be a problem.
So what should you do if you are concerned about your prostate? 1. If you are a man over 50, you must get your prostate checked by a professional every 1 to 2 years, depending on your health. 2. If you have prostate cancer in the family, you may want to start checking even earlier, from 45 years of age. 3. Your pee is the key. If you had trouble urinating or urinate too much, or you do not feel like you have finished, and if there is blood in your urine or semen, go and see your doctor. 4. As always, manage your weight and avoid smoking if you don't want to make things worse. And finally, make sure you like this video and subscribe to this channel for more life-saving tips from the LifeSavers.